right, Chapter 3 is about starting your job, what to expect. So as a CNA, you have to know your job description. Anywhere you go to work, they're going to give you a written job description that's going to have in there everything that you're expected to be able to do. If you don't know how to do something, just ask and they will train you, or they'll give you an in-service, or they'll let you check off on doing it. Okay? So don't ever try to do something that you're not checked off on how to do. Okay? There's no stupid questions. Just tell them you don't know how to do it, and they're going to help you with it. So the role of a nurse aide, you have 3 main topics. It's caregiving, it's working with the interdisciplinary team, and it's your job function as the nurse aide, or your job description. So providing care, CNAs provide about 80% of the care for the resident. You are the hands-on person for that resident. You are the eyes and the ears of nursing. It's your responsibility to see something or hear something that's odd or unusual or different for the patient, and then report it to the nurse. Okay? You're going to know when people have changes in their attitude, or changes in their behavior, or changes in their preferences, or changes in their ADLs or their activity levels. And then we need to let the nurse know. You have to balance the art of caregiving with your technical skills. You're not going to be micromanaged by another nurse, or they're not going to tell you what to do or when to do it. It's your job, it's your role, and you're going to focus on doing your skills appropriately, doing them safely, but also getting them done in the 8-hour shift that you're there. Okay? You want to be efficient, you want to get as much work done as possible, but you also need to realize that it's more relaxed it's not a rushed kind of thing. You know, if not everybody gets a bath, it's fine. Just let someone else know in shift report. But don't rush a patient through thinking that you have to get it done and that you have a million other things to do. So each individual person gets the care that they need without making them feel like they're being rushed or you're being overworked. You're not supposed to be complaining about your job to the residents. Nobody wants to hear how overworked you are and how understaffed you are and things like that. So just make sure that the residents feel like they are priorities. The focus is on giving them good quality care, seeming compassionate, seeming genuinely concerned about their well-being and their quality of life. You need to find a balance in your work-home relationships. Don't take your personal home stuff to work with you and be upset all day long because something that happened at home. In the same respect, don't take your work stressors home with you and take it out on your family because you had a stressful day at work. So providing mindful caregiving, making sure you're paying attention to detail, anticipating patients' needs, looking at the situation, considering their options, being observant, and then mostly being willing to change. Just because you go to work and you make a schedule and you prioritize things and you want to get things done at this time, if it doesn't happen that way, it just doesn't happen that way. Don't get upset about it because you didn't go follow by your plan. You know, plans change, routines change, residents have different routines, want different things, don't necessarily want to be on a strict schedule like you would anticipate you want to have done for that day. Okay. Ask other workers to help you. Ask other family members to help you. Use your resources wisely. If you need help, team up with another CNA. You'll knock it out together and get it done together. Okay. Everybody is different with their values, their cultures, their beliefs, what's important to them. There is no right or wrong, so values are individual, they're very personal, they come from your religion, your background, your friends, your education, your world experiences. So culture is a strong influence on our values, and people value different things. So just because they have different views or values than you doesn't make anybody right or wrong. Thinking of different cultural influences, people have different food preferences, they have different clothing preferences, they have different personal care concerns. Some women only like to be taken care of by women. They don't want a man to take care of them, which is fine. In the assignment, we can just switch them out with other people. So usually the charge nurse knows the woman who's requested not to have a man as their CNA. And then if it's on your assignment and you have that woman, you're just going to switch it with another CNA. Okay? The men don't generally care who takes care of them. But some men like to have other men take care of them because they feel like maybe the woman is going to drop them, or they don't feel safe with them helping them transfer. So some of the men will actually request to have the male CNAs because they feel more comfortable with transferring with them. Okay. Providing care, ethics is a huge part of healthcare. So medical ethics, or just the decision making of right and wrong. So everybody knows good from bad, right from wrong, moral duty. We did a background check on everybody. If you're working in healthcare, you can't have on your background criminal offenses that deal with abuse or neglect or theft. And that's just ethic-wise, because they want to make sure that you have a good moral character. You're not going to be the Supreme Court Justice Judge where you have to be like never drinking your whole life or anything, but you do have to have a certain quality to work in healthcare where you have a good moral ethic. Okay. And it's not saying that people do stupid things when they're young and it gets on your background, but over time it will clear from your background. But sometimes if you have something on your background, it may follow you throughout your life. So those poor decisions that you make do affect your job later on in life. If you commit a criminal act while you are working as a healthcare worker, it is your responsibility to report it to the board. So you will have a license and you are responsible to let that board know if you get arrested for something. So hopefully you don't get arrested, but things happen. Traffic concerns don't really matter, but if you are like belligerent and hit a police officer, that may result in battery, which would matter on your criminal record. Okay. Never take money from a resident. A lot of times if you're working in home health, they're going to send you into people's homes. They don't want to send people into people's homes who have on their criminal background some kind of theft. Even if it's just petty theft or shoplifting, just don't do it. It's wrong. Okay. And it will hinder your ability to get a job. But you're not supposed to be taking money from residents. A lot of times the residents that are cognitively impaired or have a little bit of dementia will try to offer you tips all the time. Like, we had a man, every time we had a meal, they sit in the assisted living, they sit at tables, and they're nice tables, and they have, the servers bring you your food, the CNAs bring you your food, and then they fill up your tea, and it may look like you're a waitress, but every day the man would try to give the CNAs a tip. Like, in his case, we just had to take the money, the CNAs would give it to the nurse, and then the nurse would give it back to the family. The family would put it back in his account. Okay, but normally we would have to just refuse the tip. Just politely refuse. It's already paid for. Oh, your daughter already paid your tip. And then they say, oh, okay. And then you can go on. Okay, but definitely don't take money even if they offer it to you. Developing trust. It takes time to learn about your residents. Without a relationship, you can't grow trust. So they want to know a little bit about you. You need to know a little bit about them. The more you trust them, the more they trust you, the better your working relationship with these people are going to be. Make the resident feel safe. Listen to what they want. Listen to their wishes. Do things the way they want them to be done. As long as it's safe, you can do it the way that they're used to doing it. Providing care. Be clear about what you can and cannot do. Be courteous at all times. Be open. Be honest. Be consistent. Dress professionally. When we go to clinical, you're going to have to wear your scrubs, your name tag. Anywhere you work, you're going to have to wear a name badge. That just identifies you as the person that works at that facility, and it gives them a visual clue about your name. Okay, so make sure your name is presented on your name tag and facing them where they can see it. Keep up confidence and confidentiality. You don't want to spread rumors about people. You don't want to tell. If somebody tells you something in confidence, you don't want to tell their family member that they told you. Okay? If they say, don't tell my family that I said this, as long as it's not harmful, it has nothing to do with abuse or neglect, if it's not going to hurt them or the family doesn't need to know, then just don't tell the family. Okay? Some people have a durable medical power of attorney, which is the person who is legally assigned to know all of their healthcare information. That would be a person that you have to share that information with. But just in general, I mean, Pam and Chris don't know everything about each other. And if Pam told me something in confidence, I don't necessarily have to go tell Chris what she said. Okay? If she wants him to know, she can tell him. You don't have an obligation to tell everybody those person's PHI or protected health information. So keep up their confidence and their confidentiality. They don't want to tell you something and then their family member find out and then the family member tells them, well, that CNA told me you told them this. And then they get mad at you because you're in the middle of it now, right? So, always starting your shift off by answering call lights first. And that's going to be a test question. Whenever you see a call light on, answer it immediately. Even if it's not your patient, you're still going to answer your call lights. Ask them what you can help them with. Tell them someone's on their way to help. Okay? Always instruct new residents on how to use their call lights. So when you get a new admission, it is your responsibility to orient that new patient to the facility. You have to show them and demonstrate to them what the call light is. This is your call bell. If you press the button, the light will go on and someone will answer you within a few minutes. Make sure you tell them the expectation that it is not instantaneous. It's not like somebody is waiting at a desk to answer this call light. The call light goes off and we will get to you within a few minutes. Okay? We're not one-to-one with these people where you're there just for them and nobody else. So make sure that expectation is known to them. The nursing team is the largest department in the long-term care facility. You are a part of the nursing team. So members of the nursing team, part of that interdisciplinary team approach again. So you're the eyes and ears of the nursing team. When you see things happen, you're going to let us know. Again, the director of nursing, this is all about the chain of command that we already talked about. You have a director of nursing, you have an assistant director of nursing, you have your unit managers, you have your charge nurses, which are usually the nurses that are on the shift taking care of the patients with you. Okay. There may be 2 or 3 of them on the floor, and there may be 2 or 3 CNAs to 1 charge nurse, or to 1 staff nurse, or a unit manager, or however the flow of the chain of command works in the facility that you're working at. So you're going to report to the correct chain of command when you're having problems. The 5 rights of delegation, this is mainly about only doing things that you are trained to do, and then delegating out things that other people can do for you, or that can help you do. You have to make sure it's the right task, so it's an appropriate activity for each individual person. You can delegate a family member to help a patient feed. Families can help people feed. You know, they do it all the time before they came in. The right circumstance, so matching the complexity of the activity with the resources and the supervision if you need it. You're doing range of motion and you're doing like leading a group, and then you're just going to tell one of the patients that they can lead the group to let all the other ones do the range of motion. And then you're just there to supervise them all doing their range of motion. The right person, so selecting someone who's qualified and trained appropriately. This is more for the nurses. They're not going to tell you to give the medications, because if you're not the right person to give medicines, they should not delegate that task to you. So if a nurse asks you to give a medication, the answer is, I'm not trained to do that. Okay. It will ask you on the national exam, the nurse wants you to give this patient the medications when they get out of the bathroom, what should you do? And it's refused to give the medications. Not give the medications because the nurse said so. The nurse really should not put you in that predicament, because that's not the right delegation, because you are not trained to deliver medications. But you should, correct answer would be, let the nurse know that you have not been trained in that. Okay. Right direction, right communication, make sure your instructions are clear, make sure everyone understands and knows what you're trying to delegate their tasks to be to do. And then the right supervision, a lot of times you'll get some kind of evaluation at the end to make sure that things are going like they should. Things are reported, feedback is getting done. Guidelines for good communication with your team. Make sure that your charge nurse knows that you are part of a caregiving role. The charge nurse is the person who's going to do your evaluation at the end of every year. You get merit-based raises, or everybody who works anywhere gets an evaluation at least once a year. And those evaluations affect your raises and affect your employment. If you are a person who never talks to anybody and nobody ever knows what you're doing or where you're at, or they may think there's something wrong with you, and then they may not keep you on. So just make sure you're part of the team, and that you're a good part of the team and a supportive part of the team, that you're able to help other people when they need help, or that you're the person that they're going to go ask to help or team up with. Not someone that's known for, oh, don't ask her because she doesn't help anybody. Okay? So you want to be a problem solver. You also want to be a good teacher, lead by good examples. Everybody should be working together to develop these good relationships between team members and charge nurses. Open communication with your nurses. It's not you against them. I know a lot of places you work, it seems like CNAs are always saying, oh, the nurses are so mean and they're so unhelpful and they don't help anybody. Some of the nurses are genuinely concerned for the same concerns you are. They're just busy as well doing other tasks. So just try to help each other out as much as possible. Okay. It's nice to work with people who are nice and who you get along with. Being a good team member means coming to work on time, being flexible, accepting assignments, not always complaining about the assignment. If you come to work every day and you're like, I always get the worst people, they always give me the worst haul, nobody wants to hear a complainer, right? So ask questions if you don't understand. Make sure you have the expectation known of what the nurse wants you to do. If you don't know how to do a task or haven't used the equipment, make sure you let the nurse know so they can help you with it the first time. Report any changes immediately. Don't just assume that the nurse is going to look at your charting and know that the person is crashing. Okay, if you get some vital signs and they're abnormal, you need to let us know immediately. Don't just put it on the chart and say, well, I took them and put them on the chart, the nurse should have looked at them. Okay, so try to be a good team member that helps out other people. Talk about your concerns, talk about your problems, be accountable, be honest, make sure you're always supportive and available. A lot of people like to go to lunch together. A lot of people like to get to know their coworkers outside of the field. There are some people you are just never going to friend on Facebook, That's okay, but while you're at work, you're decent to each other. So there should be no bickering or arguing or complaining about people, especially not complaining about people behind their back. If you have an issue with someone, you talk to them directly. Share your ideas about caregiving only with people who need to know. So you can do generic things and say, if I had a lady whose legs were swelling, what do you think I should do? But you're not going to say, Miss Smith in room 504, her legs are always swelling, what should we do? Okay. You can only share health information with people who are directly taking care of that person. So PHI is protected health information, and it's only for a caregiver who is directly taking care of that person. So don't talk about people at lunch or in the break room or in the elevator if that person isn't assigned to that same patient that you have. Okay. Guidelines for your good team relationship, again, is to only call in sick when you are sick. Don't be calling in sick all the time just because you don't want to come to work. When you call in sick, a lot of times there's nobody else to come and cover for you. So most people, we just have to divvy it up and then get more patients. The people who came to work, if you're one that constantly calls in sick, then your coworker is going to be looking at the schedule, thinking they don't want to work on the same day you're working because every time you work, you call in sick. And then they're stuck with more patients. Okay? So people see those routines and people see those patterns that go on with employees that are not so great to each other. Attend your in-services, your education classes. Be honest, be reliable. Don't lie to each other. Be open-minded. Make sure that you accept everybody's opinions, beliefs, and cultural differences. Make sure you're always following your care plan. We already talked a little bit about the daily assignment. So you are going to get a CNA assignment sheet that has a list of all of your patients on it. That CNA assignment sheet is not part of the medical record. It goes in the trash or the shred. It goes in the shred bin when you're done with it for the day because it has protected health information on it. So those assignment sheets that you get stay at the facility in the shred bin. You can't take them home with you because if you got in a car accident on the way home, all of that protected health information from their care plan is out there in your car in the impound lot somewhere. Right? So make sure you're shredding those assignment sheets before you leave work. You'll get information on there about giving care, all the information that you need. We already talked about the special needs that that person needs for the day. Sometimes the nurses will tell you, oh, this person has an appointment at 11. They need to go to a doctor's appointment. So just make sure you have that person up and ready to go by 11. A lot of times the ambulances will come pick up people for doctor's appointments, but they do not wait for you. If they have a 11 o'clock doctor's appointment, they need to be ready by 10:30 when the ambulance comes to get them. Okay? So don't wait till 5 minutes to 11 because by then they've already missed their appointment. Okay? But when the ambulance gets there, they come and pick the person up, whatever they look like. So they need to be clean and dry and dressed. But if the person is still in bed sleeping, then the ambulance is not going to wait and then their appointment gets missed. So that's kind of a little bit where you're helping them to remind them, we need to get up and get dressed by 9:30, 10 o'clock so you can get to your appointment on time. Okay. The residents don't know what day it is, let alone what time it is most of the time. You know, every day is the same. They don't know if it's a weekend or a weekday. When you get old and you don't even have a watch anymore, you know, it doesn't really matter what day it is. If you need the charge nurse for anything, if you need them to go for a treatment, an activity, if they have an appointment to keep, just make sure you're getting all that prioritized. Remember to be honest with your charge nurse about things that you don't feel like you know how to do. Never do anything that you haven't learned. This is just an assignment sheet. Like this is an example. You will be assigned a certain number of rooms, and then maybe some of your rooms are empty. But then if you have admissions for that day, it's your responsibility to make sure those rooms are set up and ready for the admissions. Okay. This assignment sheet right here, basically they have 5 females, 4, 5, 6, 7. This one has 7 patients on it. And like you can see on there, it tells you their room number, when they're going to have a bath, how they ambulate, any special needs about how they shower. This one says that they have a Hoya lift, that their blood pressure is due at 9 p.m. Their vital signs are on Sunday from 7 to 3 shift. So there's just certain things that are on this sheet that is important for you to know to do your job properly. Your approaches to care, it's going to be different in every facility. So in a lot of the videos that we're going to hear, it's going to say according to your facility policy. So whatever your facility policy is about doing things, there's different types of teams, nursing teams. There are functional teams where the one specific person does a job. At Stevens Park, they used to have a bath team where they just had CNAs that came in at 5 o'clock every morning and they gave everybody a bath. And that's all they did. That was their functional modular nursing. They were the bath team. They just did away with the bath team. So now each CNA is responsible for their own baths. So you're giving your own patient your bath. Primary nursing is more like in the hospital settings where nurses are the primary caregivers. So the nurses do everything. And the CNAs really are only taking vital signs. So that's what I used to do when I was a CNA, but then it kind of changed and we started helping with baths and things like that too. You're always, the resident is the focus of the care. So your philosophy of care is dependent upon your director of nursing. So how he or she wants things is going to be the policy. Policies change all the time, so you have to be flexible. When they implement new policies, don't be the one complaining about it. Why does everything change all the time? Every time I come to work, it's different. They're trying to work out what's best for their resident population. Okay, so they try different things. They try new treatments. They try new equipment. They're always looking for things to be easier, safer, more effective, better ways to take care of the residents, and incorporating the residents' needs and wants as well. There are federal and state regulations that provide a framework for this kind of caregiving, but each individual place can do it however they want to. We already talked about CMS and JACO. OSHA is an Occupational Safety and Health Administration. OSHA is an agency we're going to talk about in the next chapter that helps employees. So if you feel like you are working in an unsafe work condition, you report it to OSHA. Okay. If you feel like your residents are unsafe, it's reported to the Centers for Medicare and Medicaid Services. Okay. But don't report it directly to the CMS. Go to your charge nurse first and let your facility try to work it out internally before you report them to the state that something's wrong. Okay. There are major like staffing, reliability, attitudes, making sure you're coming to work. I mean, there's a lot that goes on with a work environment, making sure that there's a safe patient ratio, making sure that the equipment is there that you need. But if you feel like any of that is unsafe, then talk to your charge nurse about it. Okay. Your job functions. So a lot of this class, we're going to learn about everything that you need to do as a CNA. So be responsible to know your job description, what is expected of you to do. When you go for a job interview, you're going to get your job description, and it's going to list all of these skills that you can do. That 6-page checkoff sheet that's stapled together, that is a list of all of the skills that you will be trained to do. So you should know how to do all of those things by the end of this course. Okay? What's expected of you? Long-term care is 24/7, 7 days a week, 365 days a year. We already talked about holidays, weekends, no extra pay. You have to rotate around so it's fair. But everybody's going to have to work when nobody wants to work. When there's a snowstorm, you may be stuck at a facility and you can't leave because nobody else can come in. You cannot abandon your patient. Okay? If you are at work and you have a family emergency and you need to leave, you need to tell your charge nurse so that we know you're leaving. You can't just leave and not let anybody know you left. That's called abandonment. If you're found with abandonment, then you lose your license. Okay? So it goes to the board and they will take your license away if you have abandoned the care of someone. Now, if you're in a situation where you have a medical emergency or a family emergency, as long as you just let your charge nurse know, then it's not abandonment. Okay, but don't just up and leave because you're fed up with it. You don't want to work there anymore. Okay, when you don't want to work somewhere anymore, you still need to give them a 2-week notice. So give a 2-week notice, stick it out for 2 weeks. Don't burn your bridges because you may want to go back to that place. At that particular point in time, you may think, I am never going back to this place again in my life. But there are so many places, especially in Augusta, that own multiple places. Like University Hospital. They own a lot of nursing homes. They own a lot of family practices. They own a lot of outpatient clinics. They own a lot of hospitals. Okay? We had a CNA who was working for a skilled nursing facility, and she left. She did not give a 2-week notice. She just was fed up and she left. She got an interview at a primary care office, and they pulled her work record and found that she had left without a 2-week notice, and they would not hire her. Okay, even though it wasn't that same facility, it was the same company that owns everything. Okay? So I'm just telling you fair warning. University Hospital owns a lot of everything in Augusta. And if you burn that bridge, it's going to be hard for you to find a job in Augusta. Okay? Recognize your residents as individuals. Make sure you're promoting autonomy. Make sure you're giving mindful caregiving. Along with being a good employee, you're also good to your patient. General responsibilities to yourself and to your employer. It's hard for people to hire staff and to train you and to give you all these in-services and keep you up to date with all this training. And you may not think that it's that big of a deal, but an HR resource person is hard. It's hard to find good workers. It's hard to find good help. And then it's hard to keep training people to do a job, and then you work there for a month and then you quit. So try to stick it out. Everywhere is pretty much the same. It's not like it's going to be greener pastures at the next door or something. You know, it's all the same. You're still dealing with the same people. Just it's the person trying to make the best out of the situation. Okay. But like I said, if it's unsafe, then you need to report it to someone. But other than that, they're generally, the majority of the places around town are all pretty much the same. Assisting with your personal care. So these are the skills we're going to learn. We're going to learn bathing. So you have to help bathe people either in the shower or bed baths. Okay. We're going to learn oral hygiene, which is mouth care. You're not a dentist, but you do have to do routine mouth care. You have to make sure people are keeping up with brushing their teeth. It's just like your kids. If you didn't tell your kids every night before bed, did you brush your teeth? Do you think they brush their teeth? No. So you need to remind these people, we need to brush your teeth. Even if they have dentures, even if they don't have any teeth, they still need some oral hygiene, BID, which is twice a day. Okay. Grooming, hair care, nail care. Again, we're not beauticians, but we're going to help people at least brush their hair when they get up in the morning or cut their nails. Different facilities have different policies on nail cutting, just depending on where you work. And there's always a podiatrist if somebody needs their foot or their toenails cut. So you are not allowed to cut toenails. That will be one question on the national exam. If someone needs toenails cut, then they need a podiatrist. So we're going to let the nurse know to put them on the podiatry list, and then the podiatrist will cut their toenails. You're going to help people with dressing and undressing. If someone needs help with dressing, or you're going to give them an option, we're going to work on that skill tomorrow with giving them the option of 2 options. What would you like to wear today? Dress people seasonally appropriate or appropriate for what they like to wear. Some people like to wear long sleeves all year round. Some people are just chronically cold. They want to wear a sweater. So it's their preference to what they want to wear. Even if the person is blind, you're still going to offer them choices on what color they want to wear. Would you like to wear blue or pink today? Okay, so give them an option. And don't just pick it for them because they can't see it anyhow, right? Toileting, you're going to help people with getting up and down to the bathroom, using a commode, using a urinal, using a Foley. We're going to learn how to clean all of those things. Walking is called ambulating. We're going to learn how to properly ambulate people, definitely with positioning people. There's lots of different positions that we have to learn about. And then your range of motion exercises to help with contractures and help with mobility. So we're going to learn a lot of range of motion in the restorative chapter. Transporting patients to the dining room. You're going to have to get them up and get them ready and take them so that they're ready to eat. Preparing their environment, keeping things clean, preparing the residents, making sure their hands are washed, their face is clean, and then helping feed some residents. At our particular clinical site, there's a handful of people who will need help with cutting up their meals or even feeding. Okay. Some of them have adaptive equipment with weighted spoons or built-up spoons where they can still feed themselves. They just need a little bit of extra help. Caring for your resident after the meals, making sure that we get them back to their rooms. If once they've eaten, they can't lay down immediately. They're going to tell you they're tired, they want to go back to the room, go to sleep. But after they've eaten, they need to sit up for about 20 minutes to let their food digest so that we don't just lay them down immediately, then they vomit and aspirate the food. Recording your intake and output, we're going to have a whole chapter on nutrition where we're going to do I's and O's, or intake and output. We need to make sure what goes in is also coming out and that they're getting enough adequate input. Providing your physical comforts. We're going to do back rubs as part of PM care. So if you work the night shift or evening shift before people go to sleep, you're going to make sure that their back is clean and dry and put some lotion on it. Make sure there's no crumbs or anything in their bed that they're going to sleep on all night long. I'd put pillow fluffing because that's what you're doing. Any kind of creature comforts for them. Anything you can do to make their life more comfortable. Holding hands with the residents if they desire, that's going to convey caring. So you're allowed to touch them, hold their hands, touch them gently if they desire. Providing your emotional support, make sure you're a good listener, make sure you're working with the family members, again with the hugging or holding the residents, being there for the residents when they receive bad news. But if a family member comes in with bad news, you do not have to be in the room to hear the news. You can let them go into the room in private. If they have another person in the room, like a semi-private room, you can ask the other roommate to leave the room so that the family can have privacy with their loved one. You don't have to be in the room while they're telling them that their loved one had someone that passed away or something tragic happened to them or they got some bad news, okay? They can do that in private, either in their room or in a private counseling room or somewhere else. Just provide them privacy for that. But then after the family has given them bad news, they may want to talk about it with someone else besides their family. So just be a good listener for them with sharing experiences and being a good rebound person for them. Maintaining the resident's environment. So you do have a checkoff on this on your little checkoff sheet. Just making sure you are practicing infection control. We're trying to keep things as clean as possible, but nothing is sterile. So we're not germaphobes, but we want to make sure you're washing your hands before you touch the residents, after you touch the residents, when you're moving their belongings around, cleaning the resident's room. Don't throw away anything unless they tell you it's okay to throw it away. Some people are hoarders and they like to keep everything, but as long as you can help them to tidy it up, but don't tidy it up for them. They have to be an active part of putting it all away. Otherwise, they get very angry because you mess with their stuff. Or there is a question that talks about, like, you have a patient that's carrying around a dirty rag doll. What should you do? And it's not just take the doll and clean it. Because some people have sentimental items that smell like someone or that remind them of something, or maybe that stain on the doll was something that their child put on there. So you can't just, even though your impulse is going to be, it's a dirty doll, I'm going to take it and clean it and give them a new one. You have to ask them before you take it and clean it. Okay? So just remember to not just impulsively clean up everything. You have to have them as an active part. Even rearranging their closets. Like, they'll have clothes everywhere, and then you just want to go in there and organize it by color or something. But you have to ask them. They have to be present during the time that this is all going on. Okay. Making your resident's bed. We're going to learn how to make the beds properly with the person in it, an occupied bed and an unoccupied bed. And then preventing injuries and safety. CNAs are not responsible for medical care. There's a question about, you have all these different kinds of residents, who would you be best able to help? You cannot help the very sick or the very ill. Those are the residents that the nurse is going to be able to help. But you can help a new admission because it's part of your job when new admissions come in to go orient them to the facility. That's something that you can do. So if you get a new admission or you have a very sick person, the nurse should be taking care of the very sick person. The nurse can be giving them oxygen, can be giving them breathing treatments, can be giving them medications. You can't do any of that. You need to go help the new admission that's coming in, that needs to be oriented to the floor, that needs to know how to use their call light, that needs to have their inventory sheet filled out. So just think about things that you are able to do in your job description and how you're best utilized for your job needs. Part of your job description is attending these in-services like we talked about. It's going to be at least 12 hours a year, so they usually like to do like one a month. And it's on different things. Every month it's a different topic. It could be mouth care one month. It could be fire safety the next month. It could be CPR the next month. But just make sure you're going to the NIN services to constantly learn and get refreshed, or even learn about new equipment. Sometimes they come up with a new lift, and then they come in and they show you how to use the new lift. And then you have to go to the in-service on the new lift training. And you get paid to go to the in-services. So you got to clock in, and they'll have postings and give you several times. Like you can go when you're not working. You have to go like during a time that you're not on shift trying to take care of patients too. Because usually the in-services last an hour, and you can't spend an hour of your time in an in-service while nobody's taking care of your patients. So you would come on either before your shift or stay after your shift for an hour a month to get paid extra to learn something. Okay. When you do your job, do it well. Make sure you take care of yourself physically, emotionally, stress relief. Sometimes it's difficult to cope with different stressors. If you have problems, there's always the social worker or some kind of company phone number that you can call for help. You can also talk to your charge nurses or even other CNAs or people that are going through your same situation with you. To be able to deal with stress in your life, you have to figure out what's causing your stress, but you also don't need to bring your work stress home with you or your home stress to work with you. Okay? So make sure that there's several factors that deal with stress relief. But if you have any problems with stress, if you feel like you need to have some time alone or some time off, you can usually ask for a vacation or ask for some time off, or just take a personal day is what they call it. Just taking a personal day to de-stress, to get rid of some things on your list. Let's see. Ways to cope with stress. Make time to do something relaxing for yourself. So if you like reading or walking or spending time with a friend, then do that. Some people like retail therapy where they go shopping, even if you're just window shopping. But talk to a friend, talk to a spouse, talk to somebody outside of work if you're having stress, but don't give them specific situations about people at work or protected health information. Exercise is very important. I know we feel like when we go to work, we're just on your feet 24/7, walking around, but you do still need to set time aside for an exercise routine, so you're getting at least 30 minutes a day of exercise. They've proven that exercise is just as effective as antipsychotic medications in some people with depression, because exercise releases the serotonin and makes your brain feel better. Okay? So even if you go for a run or go for a walk, it could help with depression. Eating a good balanced diet, getting plenty of sleep. You should be getting 7 to 8 hours a night of sleep. Lack of sleep is just as detrimental to your health as smoking or drinking or drugs. So you have to have proper sleep in order for your brain to heal, in order for your cells to heal. If you're not getting enough sleep at night, then you need to figure out why you're not getting good sleep. And if you're not sleeping well at night, you're going to be sleepy during the day, and then it's going to be hard to do your tasks appropriately. Coping with loss and death. When you're working in healthcare, there's going to be a lot of death. But you're going to, and it's not that you're going to get used to it, but you're going to learn, you're going to develop better coping skills. It's very emotional when anybody dies, even if they're not related to you. If it's someone you knew or someone you worked with or someone just, when you see someone in the news and you think, oh my gosh, I knew that person, it just becomes more personal for people. So when you're working in long-term care or any kind of healthcare facility, people are there because they're sick. They're not all going to die. Some of them are going to get better and go home, and it's wonderful. But there is a lot of death and dying, and you'll develop better coping skills. But it's okay to cry. It's okay to feel like you need some help. The chaplain will talk to patients as well as families as well as workers. Okay? If you want to go to people's funerals, you're allowed to. If you don't want to go, you don't have to. So don't feel obligated. It's just your comfort level with how you feel about attending funerals and things like that. Let yourself be sad. Sometimes you need to get away from the situation. Sometimes you just need to be alone. Sometimes you just can't deal with it anymore, but that's fine. Just don't let it get to you personally or make you feel like there's something wrong with you. Okay, any questions about your job description?